All right. So welcome, everyone. Again, this is Bethany Hamilton. I'm with the National Center for Medical Legal Partnerships. Welcome to our June 16th, 2021 Eviction Crisis Town Hall event. This is a very special event because it is urgent, and we in fact do have an eviction crisis before us. What we're here gathered to talk about today is eliminating the existential threat to our recovery. The recovery we are talking about is that pandemic recovery and our overall economic recovery as a country. We are joined by some very special guests. First and foremost, though, I do want to acknowledge and thank our sponsors for this event. Several of us are partnering as what is called National Training and Technical Assistance Partners. The National Center for Medical Legal Partnership is one of those HRSA grantees, and they have helped to sponsor and support this event today. The partners I'm referring to at the organizational level who have helped us pull this together really are, as on the screen, named the National Legal Aid and Defender Association, the Network for Public Health Law, the National Healthcare for the Homeless Council, National Center for Health in Public Housing, and the Corporation for Supportive Housing. I just want to pause for a second here and say that many of you joining us here today are also our partners at the local and national level, and we thank you for your continued support in public health, social justice, and ultimately justice for all Americans around the country. As Americans continue their efforts to vaccinate, unmask, and return to something that resembles normalcy around the country, we know that these large-scale evictions that were looming are now upon us. On June 30th, the CDC eviction moratoria is scheduled to end, and both court challenges have threatened, as well as around the country, confusion, just mass confusion about the applicability of the moratoria has threatened our eviction response efforts, and they have threatened our pandemic response efforts, and they certainly pose a direct threat to our long-term recovery. So we're here to talk today about how we can collaborate across industries, sectors, practices to really come together to eliminate this threat once and for all. We're going to talk a little bit about how to address it from every angle and how we can look long-term towards prevention as our ultimate goal. We're going to call out the threats through our panelists today. We're going to identify some solutions through actions that are being taken at the local level as examples of what you all may want to take up at and for your communities so that we can ensure a full and equitable recovery. You've already heard from me. I'm a co-director here at the National Center for Medical Legal Partnership. You'll also hear from Regina Reed of the National Healthcare for the Homeless Council and Radica Singh of the National Legal Aid and Defender Association. We are so happy to be joined by a very special guest moderator, Pam Fessler. She's a national desk correspondent with NPR. That's where you've probably seen several of her articles and what she's written on poverty, philanthropy, and voting issues. But she also covered quite a bit following 9/11, continues to cover topics related to housing and homelessness, affordable housing issues, income inequality, and the accolades go on and on. What you'll see we've uploaded, just so we can save on time here today, is bios for all of our speakers. But I do want to put in a special plug for her new book, because we are in this public health and policy space. So I really just want to, I'm just going to personally recommend that you check out her new book, Carville's Cure, Leprosy, Stigma, and the Fight for Justice. It is very, very, very much aligned with the same conversation we're having today. And we'll put in a link so that you guys can check out the book. So that's my personal plug. Check out her book. We're also joined by several expert panelists today, and in the resources that we will share throughout the chat and in follow-up, I do want to put in a plug for their resources as well. But first and foremost, we're joined by Diane Yentl. I know many of you know her and have seen her. She's with the National Low Income Housing Coalition. MLPer Emily Benfer, who's at Wake Forest Law. Kerri Lowrey with the Network for Public Health Law, who we partner with as well. For those of you working on health and housing issues for MLPs, you've probably heard from Kerri several times on a cohort group that she's helping to lead. Osa Rugwe of Community Legal Services of Philadelphia is also joining us, and we'll be talking about some of the local efforts. Just want to put a plug in for her as well. She's also an MLPer. And so in terms of, the diversity on this panel, those of you who are younger MLPers, newer to the field, here's your voice, here's your representative, and we're really happy to have her join this panel as well. Dr. Peter Kahn and Jennifer Bosco actually work together, but Peter is at Yale School of Medicine and Jennifer Bosco is at the National Consumer Law Center. They'll both be talking about some of the underlying issues that you may not immediately recognize as evictions, but are in fact causing housing instability around the country. So we'll hear from Peter and Jennifer more about what they're working on together. I'm going to turn it over to my colleague Danielle to go through some quick housekeeping, and then we'll certainly move right into hearing from both Regina and Radica.
Hi, everyone. My name is Danielle Rahajasan. I am the project lead here at the National Center for Medical Legal Partnerships. And I, along with my colleague, April Daniels, will be running tech for this town hall today. We have a great event prepared for you today, but before we begin, we want to make sure that you have the best experience. So I'm going to go over a few small housekeeping things with everyone. You all joined on mute for today's session. However, we do encourage you to type in your questions in the chat function at any time, as it will be an opportunity for us to connect and have a rich discussion. We will try to get to as many questions as time will allow, including those that were asked via the registration process. However, because we do have a large audience, as Bethany has mentioned, we may not be able to get to all of them. Also, we are using Zoom for this town hall. If for any reason you're having trouble with the platform, or if your colleagues could no longer log on because we have reached capacity, we're also streaming the event on YouTube. And I believe my colleague April Daniels has already shared the link for that in the chat. And finally, we are experiencing, if you do experience any technical difficulties or need anything else, please do not hesitate to email or chat with either April Daniels or myself, and we will do our best to assist you. We will also share our emails and in the chat. So without further ado, I will hand it over to Regina Reed from the National Healthcare for the Homeless Council, followed by Radica Singh from the National Legal Aid and Defender Association.
Hi, everyone. Thanks so much for having me. I'm Regina Reed with the National Healthcare for the Homeless Council. It's good to see so many friends and colleagues on the panel today and in the audience. The National Healthcare for the Homeless Council supports clinics around the country that care for people experiencing homelessness. Members of our community, and that includes people with the lived experience of homelessness, as well as the frontline providers who support them, know very, very well that housing is healthcare. This is not a new concept for us. However, the COVID-19 pandemic really demonstrated how housing is healthcare in a way that many community leaders and policymakers, folks who may have ordinarily turned a blind eye to the issue, could no longer ignore. You can't isolate and quarantine when you're living on the streets, or wash your hands regularly, or follow many of the basic public health guidelines recommended during a pandemic, or at least not follow them easily. So we know that poor health can cause homelessness, that homelessness perpetuates bad health and makes treatment and recovery from injury or illness more difficult. And we also know that the experience of poverty, the experience of facing a threat of addiction, that in itself is very traumatic, and that trauma is damaging to an individual's health. And I know we'll be hearing more about the public health impact of evictions from some of our expert panelists in just a few minutes too. So while the immediate threat of COVID-19 wanes, the need to keep people safely housed absolutely does not. The healthcare safety net was completely overburdened over the last year and a half, and should not now be given the additional burden of having to care for all of those who are going to be newly in poverty and newly kicked out to living on the streets. The pandemic showed us the terror of what happens to your health if you don't have a home. But it also, on a more positive note, showed us how fast some communities were able to respond and to find beds and to find the hotels for isolation and quarantine. While our community has been fighting for decades to end homelessness and get this safe and secure housing, we saw during the pandemic that it is indeed possible, and possible pretty quickly, and that the only real barrier is political will. Healthcare providers and people living in extreme poverty need momentum to continue around securing housing as a human right. Homelessness is still an emergency, and I very much look forward to hearing from all of our expert panelists on how to make this happen. Thank you so much for having me. Housing is healthcare. And with that, I believe I'll pass the mic over to Radica.
Thank you, Regina. Let me express my appreciation as well for the opportunity to co-host with the National Center this event, and it's nice to see so many advocates in the audience with whom we work across the country. For people who don't know, the National Legal Aid and Defender Association is a national membership association and advocacy organization for civil legal aid advocates, public defenders, and the client communities that they serve across the country. And really, what civil legal aid does across the country, it's often an invisible support, but such a critical support, is provide access to legal assistance for people who can't afford a lawyer, and really in basic areas of need like housing, like healthcare, like we're talking about today, but also areas like education and employment and so many other basic needs and services that I think a lot of people across the country may have taken for granted up until this point, and that affect low-income people and communities differently. There really isn't a way to isolate any one issue. They really mesh together in a spectrum, and that's true for civil and criminal issues, which is why we sit at that intersection. And I think you'll hear our panelists talk about some of the long-term effects of evictions, which include being pulled into the criminal justice system, certainly for low-income people. With regard to housing and healthcare, I do want to thank HRSA, as Bethany mentioned earlier, also SAMHSA, and many other federal agencies in the executive branch that already have recognized how important legal aid is as a supportive service, as an enabling service, and in advancing healthy and stable communities. Just with regard to legal aid, I think specifically in the housing context, and again, these interventions can take place in different forms. It could be access to a court process. It could be a more upstream access that I think our panelists will talk about with regard to medical legal partnerships with something else, but really it is the intervention that includes legal assistance that we're seeing have such an impact across the country. So with regard to evictions, when we're talking about power dynamics and the court process, we're at a stage in our country where 90% of landlords are represented by a lawyer and 10% of tenants are. And we have data that shows that with the intervention of legal assistance, people can remain housed where that's not, where that may not be the best solution. Legal aid can help negotiate more time to move, reduce the amount of back rent and debt that is owed, that you'll hear our panelists talk about. And so many other pieces that are just so important, avoiding a record, again, which you'll hear folks talk about. And we're seeing that come through in many of the diversion programs that are being stood up as well. The importance of coupling that type of collaboration with legal assistance and what that means for our communities long term. I will say, in terms of the long term and the collaborative efforts that you will hear people talk about, we were very excited to see the President of the United States, the Attorney General, really reinvigorate this concept that legal aid is part and parcel of federal objectives for stable and healthy communities, with the breathing new life into the Legal Aid Interagency Roundtable, reinvigorating, reestablishing an Office for Access to Justice that can look at these issues wholesale, again, not in an isolated event like an eviction filing, but broader, long-term. What are the front-end pieces that are pulling people into this crisis, and what are the back-end pieces to help people break out of the spiral that will be created by an eviction filing? The final piece that I want to mention, and I know our panelists will talk about, is the issue of race equity across the board. The truth is, and the fact is, and as all you know, people are affected differently and disparately by evictions. 80% of people who are facing eviction are Black people. We are at a stage, again, in our country where the percentage of the Black population is sometimes a more accurate predictor than the poverty level in some areas. And so I think that is a piece that we need to look at as we build our collaborations, as we develop our solutions, and as we move forward. And we can't pretend that this affects people differently, and we need to look at solutions that will help us resolve those issues. So thank you again. I think I'm passing it back to Bethany.
Yes, thank you so much, Radica. Thank you, Regina. With that, I'm not going to delay us any further from our main event. I would like to now pass the mic on to Pam Fessler, who will be moderating a conversation with our subject matter experts. As Pam begins, we'll go ahead to the subject matter experts. We'll be pinning everyone to the screen to make sure you're highlighted. So give us a moment, but we'll continue streaming. Thanks, Pam, all yours.
Hi, thank you very much, Bethany. I really appreciate it. And we've got such a great panel that I really want to get right to it. We're going to start just briefly with each of the panelists, just talking a little bit about some of their work and, sort of what they see as the lay of the land. And I wanted to start with Diane. Diane, as Bethany mentioned, we've had the eviction moratorium that's been in place in some form or fashion throughout much of the pandemic, but it's set to expire. The federal one is set to expire at the end of this month. It's also being challenged. We also have all this emergency rental assistance that, the federal government's trying to pump out to help renters. What do you see happening with the eviction moratorium? Is it going to get extended, or what do you think will happen? And if it isn't, what do you think the impact's going to be?
Well, thanks, Pam, for the question. Thanks for the opportunity to be here. It's hard to say what the administration is going to do. I think they are well aware that if they allow for the federal eviction moratorium to expire at the end of the month, that as it's currently scheduled to do, there are 6 million renter households with as many as 15 million people within them that are at heightened risk of eviction because they are still behind on rent. So, I think to best understand the challenges that we face now and that we faced during the height of the pandemic, we have to recognize where we were before the pandemic even came to our country, which was in the midst of a severe affordable housing crisis, where we had a shortage of over 7 million homes affordable and available to the lowest income people. So another way of saying that same number is for every 10 of the lowest income renter households, there were fewer than 4 apartments that were affordable and available to them. So because we had such a shortage of homes for those lowest income renters, and because we have such a underfunded and gaping holes in our housing social safety net, we had about 10 million very low income households who were paying at least half of their income towards rent. And many were paying much more, 60, 70, 80% of their income just to keep a roof over their heads. So when you have such limited income to begin with, and you pay so much of it for your home, you are always one financial shock away from missing rent and facing eviction, and in worst cases, becoming homeless. So for those same 10 million renter households who struggled to pay the rent pre-pandemic, the coronavirus and its financial fallout was that financial shock. They lost jobs, they lost hours at work, they lost wages, they had increased costs for internet and childcare and food, and they fell behind on rent. And there were some, especially early in the pandemic, there were some protections and some limited resources put in place to help renters stay stably housed. So first, we had a much more limited federal eviction moratorium that only covered federally subsidized properties. There were some limited funds that some communities used for emergency rental assistance. By August of last year, most of those resources had been depleted. Most of those protections had expired. And at that point, we were at really the height of the crisis, where we had 17 million households at heightened risk of eviction. That was when the CDC put the federal eviction moratorium in place. And generally speaking, it's done what it was intended to do, which is keep tens of millions of people stably housed during the pandemic. But it was always a half measure that needed to be paired with the rent money that was still due. That didn't come until very late, until December of last year and March this year, when Congress appropriated a combined $46.5 billion. By then, by January this year, there were about 8 or 9 million renter households who owed about $50 billion in rental assistance. So now we're in a race against the clock. The federal eviction moratorium is set to expire at the end of the month. We're certainly urging that it be extended further and hope that it will be, but it may well not be. And this emergency rental assistance has not and will not in time reach low-income renters and landlords who need it to stay stably housed. So Again, if the Biden administration doesn't act quickly to both extend that moratorium and activate a whole of government approach to get that emergency rental assistance out more efficiently, more effectively to the people who need it, then we will see a historic wave of evictions and housing instability this summer and this fall.
So Emily, I know you've done a lot of work about the health impacts or the health effects of evictions. So if in fact we do see this wave of evictions in the summertime or in the coming months, what impact do you think that's going to have both on health and also I think racial inequity you've also done some work on?
If the moratoria lifts before the rental assistance is in place, I think we can expect to see spikes in COVID-19 transmission, infection, and mortality in the communities that have been hardest hit by the pandemic. And I want to explain why that is. So first, during the pandemic, 43 states instituted state-level moratoriums across the country. And when those lifted, about 29 of them lifted over the summer months, we looked at COVID-19 infection rates in those states. And what we found was that when you lift a moratorium, it's associated with a 2.1 times increase in COVID-19 incidence and a 5.4 time increase in mortality. And this is after controlling for all the other pandemic interventions like mask mandates, school closures, stay-home orders. What this amounted to in just the summer months was an excess infection of 433,700 cases and 10,700 excess deaths. And that was like 4,450 some deaths just in Texas alone, for example. So just in that truncated amount of time, that major increase in infection and mortality as soon as state moratoria is lifted before the CDC moratorium was in place. So at the same time, we know that vaccinations have been rolling out really quickly and we're getting higher rates of vaccination across the country. But the communities who have been hardest hit by the pandemic, who are at the highest risk of eviction, are not yet vaccinated. Those vaccinations have not reached them. In fact, the Eviction Lab recently identified, by looking at every jurisdiction for which they were able to find data, a higher rate of eviction filing patterns in the communities that have the lowest rates of COVID-19 vaccination across the country. So the COVID-19 vaccines are not reaching the highest eviction neighborhoods. And this suggests that those most at risk of eviction are also at the highest risk of contracting and spreading the virus. The other compounding factor here, and this is not because people don't want to be vaccinated, the barriers to vaccination have prevented over 30 million Americans from actually accessing the vaccine, those who are willing to do so. And we're also seeing that the barriers include things like inability to get out of work, no transportation, no convenient vaccination site, no childcare, language barriers. So the barriers are very, very high and in some ways insurmountable for so many communities. At the same time, even if all of those communities were vaccinated, we know that 1 in 5 families with children are adult renters with children are behind on rent and at risk of eviction. And many of those kids are ineligible for vaccines, any child under 12. So this could mean that as we're seeing increased risk among the child population with over 4 million children having tested positive for COVID-19, that we would be placing the people who have been hardest hit by the pandemic, who are suffering extreme disparity in pandemic experience that are largely communities of color, will be pummeled by COVID-19 infection. And we also know that the people who are at the highest risk of eviction also are the most likely to have comorbidities that place them at extreme risk of complication or death if they contract COVID-19. So what this means is that lifting the moratorium before rental assistance is in place and risking eviction and exposure to COVID-19 is ultimately perpetuating health inequity among people of color across the country and guaranteeing that the disparity that we've seen in the pandemic experience throughout the last year and a half will be furthered, and that gap will be so cavernous in health equity, in housing stability, in economic stability, that it will be something we cannot bridge in the future and affect future generations to come. And this isn't just limited to the COVID-19 experience. Eviction itself actually affects the entire life course. For children in particular, it's incredibly traumatizing. It is experienced as a trauma, and it affects emotional well-being, academic achievement. It's associated in numerous studies with lead poisoning and the permanent brain damage that it causes, with asthma, with food insecurity, and it even is shown to take years off a child's life. For a woman who is pregnant during an eviction, it can result in preterm pregnancy and low birth rates and other adverse effects for that child. So even before they started out, being evicted in the womb or before you're born is incredibly traumatizing and sets that child, as well as the entire household, on that downward trajectory that can be impossible to recover from in lifetime, if not the next generation. And so we see these physical and mental health effects across adults, children, and even in barriers to livelihood, like failing credit scores, downward move to the outskirts of society, to substandard housing. It is both a cause of unemployment and a barrier to seeking employment at a time when that is so critical. So ultimately, all of this is to say that housing is this foundational, fundamental pillar of resiliency, stability, and livelihood. And when we wipe that out, we are guaranteeing that families and individuals cannot recover at this time that is so critical for their health and well-being.
Thanks. And Kerri, if maybe we can talk a little bit on a sort of practical, sort of against this, pretty dire backdrop. One thing I've noticed a lot in my coverage, one is that a lot of people still were evicted during the pandemic, even with the moratorium in place. And then, in such situations, we see quite an imbalance between the tenants and the landlords in terms of fighting evictions in court. Can you talk a little bit about some of the work that's being done to try and address that imbalance and I just find that there's so many tenants that really have no idea what they should be doing or what kind of protections that they have out there.
Yeah, thank you, Pam. So it's funny that you asked me for the practical because I'm a researcher.
Oh, really?
I only got practical this past year because of COVID, and kind of forced to, actually be a real lawyer and represent people in housing cases. But I saw up close and personal how important it is for folks to have legal representation in these situations. And that's because of the obvious power imbalance. Many jurisdictions, if not most, have a legal structure that's really not friendly for tenants and is very favorable to landlords. As someone already mentioned, I think it was Diane, that 90% of landlords are represented in court nationwide, and about 10% of tenants are, which is a major problem. I know in Baltimore City, it's much lower than that. It's something like 1% of tenants show up with an attorney. And we know that legal representation helps to ensure due process of law, obviously, and procedural fairness. And in the situation of COVID, you mentioned that folks were still being evicted, and a lot of that is because jurisdictions were free to interpret the nationwide moratorium and even the statewide moratoriums individually and kind of as they see fit. So not only from jurisdiction to jurisdiction, but from courtroom to courtroom, the moratorium was interpreted differently, sometimes applied as an affirmative defense, sometimes, not considered at all. Landlords were allowed to evict for other reasons, like kind of a made up breach of lease, for example, which technically didn't fall under failure to pay rent. And so they could be evicted for those reasons. And so for that reason alone, it's really important to have an attorney to stand next to you and say, Your Honor, this is not a failure. This is a failure to pay rent case. This is a situation where the landlord's trying to make this into a breach of lease where no substantial breach exists. And so for those reasons, really important. Current resources right now are insufficient for many jurisdictions to be able to provide right to counsel in civil cases and in landlord-tenant cases in particular. So for example, in Maryland, we just passed a right to counsel law, but it still remains unfunded. And I think that is, likely to be the case in other jurisdictions as well. I don't think we're special in that regard. But just a last pitch for, the kind of, we heard about all of the public health implications, but I did want to say that there's research out there that shows that when people are represented by counsel, there are more favorable outcomes for tenants. That's been demonstrated. Decreased risk of eviction, decreased likelihood of homelessness as a result, increased stability and able to re-rent. So, one of the things is, we had a couple of folks who, and I'm sure many on the town hall who are listening, had the same situation where there really just isn't a legal defense because of the legal structure that I talked about. But you can do things like negotiate a move out date that's conducive for the tenant and for their family. That kind of gives them an opportunity to get their feet under them and get supports in place before they have to vacate the premises. So, attorneys can help to negotiate a move out date, can help to make sure that if they comply with those provisions that are put in place, that the filing, it doesn't stay on their record, so that they are able to re-rent in the future, which is a major problem. Emily talked about credit scores and the ability to re-rent. And in a situation where low-income housing is already very scarce, is a major problem that's only going to get worse as we see the moratorium expire. So I can talk a lot longer about right to counsel.
We'll move
stop there, so we can.
Well, thank you. Thanks. Actually, Sarikwe, maybe you can talk a little bit about what you guys are doing in Philadelphia. It sounds like you're doing some interesting things. And can you also talk a little bit about what you are doing, how landlords are fit into what you are doing?
Certainly. So here in Philadelphia, like many other US cities, we were facing an eviction crisis even before the pandemic hit. We had the fourth highest eviction rate among large US cities, with over 19,000 eviction filings in 2019 alone. When the pandemic hit, Pennsylvania saw a 4-decade record of unemployment with a rate of over 15% by September 2020, and approximately 355,000 people across the state were not current on rent or mortgage payments by September 2020 and had slight or no confidence that their household could pay the next month's rent. So in July of 2020, Philadelphia passed the Emergency Housing Protection Act, which was a set of bills that's focused on tackling the crisis and keeping people housed while the pandemic was ongoing. One of the bills created the Philadelphia Eviction Diversion Program, which is a pre-filing program aimed at just that, diverting tenants and landlords from the court eviction process. The program, after it was established, has been a success due to several factors. One, the program is a pre-filing program, which is important in terms of improving housing stability, because even having an eviction filing on a tenant's record can lead to having ongoing problems with finding housing in the future and lead to that housing instability that many of my colleagues have spoken about. The program also pairs tenants with a housing counselor when they register for a mediation session, and that housing counselor helps the tenant navigate resources to stabilize their housing, including rental assistance, which is another key point. So with the national relief packages that have been passed since the pandemic, there's more rental assistance available to tenants than there was before. But having rental assistance available is not the same as having it being accessible. When the government assistance programs come out, we know that there'll always be rules and requirements for applying and submitting documentation to get assistance. But consulting with on-the-ground advocates is a really important step in making sure that tenants actually have access to this assistance. This includes policies like accepting many different forms of documentation when it comes to income and loss of income, accepting different forms of documentation when it comes to proof of residency, allowing tenants to self-certify when they're not able to get or provide documentation, and allowing rental assistance to be paid out with flexibility on where the funds go and how they get delivered. So Philadelphia has done a lot of work in making sure that our rental assistance application website is accessible, that the forms are easy to navigate for tenants, and that there's staff available to help tenants who are facing barriers. But we always want to make sure that we're consulting with direct services advocates when we create these rental assistance programs and rules, so that we don't create programs that seem great on paper but have significant issues on the ground. And then finally, I just want to touch briefly, because Bethany named me as the young MLP representative on this panel, which I appreciate that, Bethany. So I just want to talk a little bit about medical legal partnerships and their role in fighting evictions. Because if we think of an eviction as a timeline, a progression of events that does not start just at the court filing, but starts when the tenant's financial situation changes, when a dispute arises between the tenant and the landlord, or when the tenant gets fed up with a long-standing repair issue and decides to start withholding rent, then there are many points along that timeline where we can advocate for the tenant before we get to an eviction filing. But many tenants do not seek out legal assistance until their eviction problem becomes a legal problem. Either they've received that notice to quit or notice to vacate, or they've been served with the court papers. And as that timeline goes on, the options to stop the negative effects of eviction diminish. One unique aspect of my work at the Medical Legal Partnership is that I tend to get housing cases well before they reach the point of crisis, because a patient family attends a routine doctor's visit, mentions to a medical provider that they are having a housing issue that could be affecting their family's health. And because I'm able to get involved in the case right at those earlier points we spoke about, for example, right when the tenant has had enough with a longstanding repair problem and is wondering if they should continue paying rent, we're able to sort of engage in a very early eviction diversion process by counseling the tenant on their options, contacting the landlord if necessary to try and resolve the issue, or filing in court on behalf of the tenant before the landlord is able to file that eviction. And that early intervention is key in preventing and ultimately increasing preventing eviction and ultimately increasing housing stability. So the MLP model really works in that regard. And to that, I'll pass it back to Pam.
Thank you very much. And now we're going to actually shift to a slightly different angle of this problem, and that is about utility assistance. Peter has done who I think gets the award for the best backdrop there, has done some work on this, what the impact is on both evictions, but also having your utilities turned off for people who are facing medical demands. Maybe you can talk a little bit about that.
Sure, and thanks so much for having me. The background is actually the Sterling Hall of Medicine at Yale. Everyone's welcome to visit, certainly. This is actually what it looks like when the cherry blossoms come out. So I think the idea of thinking about eviction as a continuum, which is the terminal point at which the eviction actually happens, brings up this important notion of how utilities in many ways can play into the lives of patients who suffer from very serious medical illness. And that was really this notion that folks who suffer from advanced illness have all types of medical issues across the spectrum, which may ultimately lead to eviction, was really, as others have mentioned, brought to the fore by the COVID pandemic. For me personally, as someone who was on the front lines as a provider, I'd like to just share a brief story which I think really highlights this notion. So we had a patient here at Yale who recovered from COVID, which is obviously we're very pleased about, but as part of the recovery required an oxygen concentrator. And I, along with my colleagues, sort of naively prescribed the oxygen concentrator because that's sort of the quote unquote right thing to do medically. The patient needs it. We prescribed it, and indeed the patient received the concentrator. Unbeknownst to the entire sort of provider team behind the scenes, when the patient plugged in the oxygen concentrator after month number 1 and received a bill that was significantly more expensive than this person was expecting, it became obvious that this device was not something that was sustainable for this patient in the long term. And that's actually a very serious problem on a number of different levels. Patients who are unable to use medical devices because of the cost of these devices incur a whole host of problems that we're now only starting to uncover through our research. These problems are sort of some of the obvious non-optimal health due to conditions not being treated. But also, unfortunately, not using medical devices as they're prescribed can lead to a host of predictable consequences. Urgent care visits, emergency department visits, hospital admissions, and ICU stays. Our research, in addition to uncovering these unfortunate consequences, has also uncovered that patients routinely underestimate the cost of how much they incur cost-wise to actually use these devices. And so if you ask a patient, what is the cost of running an oxygen concentrator at whatever number of liters per minute they use these devices, they routinely underestimate to a significant extent the actual cost, which makes it hard to budget and plan appropriately for these devices. A second aspect of utilities that I'd like to comment on in this context is the different types of protection programs that my colleagues at the National Consumer Law Center have pointed out in their recent report on this topic. And medical protection programs for shutoffs or delays in shutoffs or based specific rates that help those who have medical illness. These programs vary significantly by state to state. Here in Connecticut, a recent paper that my colleagues and I put together demonstrated that there are different groups that have access to these medical protection programs. And unfortunately, these groups are not exactly the ones that we would think represent the population as a whole. So our research found that patients who are Black or who had other significantly greater disabilities like end-stage kidney disease and diabetes were more frequently affected by energy insecurity and thus resorted to these programs. And so again, returning to this notion of eviction as a continuum, which has various different points of contact with various support systems, the need to be able to afford utilities for health devices, this is likely some significant component to what ultimately may resort or end in the end stage of this continuum, which is facing an eviction.
Thanks. And actually, Jennifer, just taking off from that, what do you think, maybe you can talk a little bit about some of the programs that are already out there to help address these problems. And then, what are some of the other problems that you think still do need to be addressed, and what can people do about it?
Sure, thank you. Well, yeah, absolutely. I want to just sort of lay out for people the types of protections that are out there and that may exist in your state. And I think, there's a recognition, of course, that a loss of utility service is one of the, as a potential cause of losing your housing, but increasingly during the pandemic, I think there's a deeper recognition of the health and safety implications of having your utilities disconnected because of non-payment. It's a big problem even before the pandemic. About a third of the people in the United States reported having problems with energy insecurity, and millions of disconnections would happen each year for non-payment of utility service. So during the height of the pandemic, there were most states had some type of moratorium order that prevented utility disconnection, at least of electric and natural gas service. Most of those have expired. There are a couple that are still remaining, but those will be ending soon. So for people who had been protected by those, but who might still be part of a vulnerable population, there may be other services available or protections available in their states. And the types that are out there are the serious illness protection or medically vulnerable protection that Peter just spoke about. Almost all states have something on the books. The exceptions are Alabama, Alaska, Louisiana, and North Carolina, I believe, that don't have one, but other states have some sort of protection in place to keep the utility service on for people with a serious illness or disability. And NCLC has actually done a report analyzing the different state protections. It's available on our website. It's called Protecting Seriously Ill Consumers from Utility Disconnection. So you can look up how your state fares compared to the other states. There are also a lot of states have protections for elders that are just based on age, might also be based on income as well. There are protections for heat and cold. So there might be in some states a winter moratorium on utility disconnections for non-payment because it's unsafe to go without utility service during the winter. In other states, there might be a summer protection. And then there are a number of types of bill payment assistance programs. So besides the ERAP funds where a portion can be used for utilities, There's the fuel assistance or LIHEAP program that's available in different states. Many states have either a discount rate for low-income people or percentage of income payment program for low-income people. And there also are an increasing number of states that are adopting a type of payment plan called an arrearage management program, where if someone is low income and stays current on the payment plan, they get a credit that forgives part of their past utility debt for each month they stay current. So to find out more about those, you can certainly look at our website. We have a lot of resources available. You can check with your state utility commission or state utility consumer advocate. Thank you.
Thank you. And thanks to all of you for, I mean, you're just doing such incredible work. And I think you've really shown the scope of the problem here. I think one of the interesting things, and I hope we all can have this discussion now, if you maybe unmute everybody or the panelist. And, you know, we're in what seem like unprecedented times, right? So we have this extraordinary problems, especially because of the pandemic, but we also have billions of dollars that's being pumped into the system to try to address the problem. So I guess what I'd like you guys to talk about a little bit is, you know, what you think is the most immediate thing that needs to be done, and what can, you know, the people who are on this call or who are participating in this town hall, you know, what are the things that they should be trying to do to address the problem? And it's not only a short-term problem, but we also have the long-term problem of this, you know, overall lack of affordable housing. Who wants to go first? Nobody. Oh, Diane.
Glad to. Sure, glad to, Pam. In the most immediate term, you know, we have a tremendous obligation and responsibility to get this emergency rental assistance to the tenants who need it to keep them stably housed whenever the moratorium expires, because nobody expects the moratorium to be around in perpetuity. Certainly, we're going to continue to push to get it extended, but it will end. And we have to ensure $46.5 billion is historic emergency assistance for renters, many 46 times as much as was available for renters after the foreclosure crisis. So we have a tremendous obligation to remove obstacles, to simplify processes, to center racial equity, to develop programs that are accessible to the lowest income people, to do the kind of focused, deliberate outreach to marginalized communities that's necessary to get the money to the renters to address the arrears that have accrued, keep people stably housed. Even when we have done that, we still will not have addressed the long-term sustained shortage of homes affordable for the lowest income people. Because as historic and unprecedented as these resources are, they do nothing to address that underlying shortage. So we also have an incredible opportunity right now where many things have aligned as in terms of public consciousness and awareness about housing as healthcare, a president who is committed to universal vouchers and speaks as housing as a human right, and Democrats in Congress intending to be really bold with their majority and potentially pass another major spending bill through reconciliation, potentially multi-trillion-dollar spending bill that recognizes housing as infrastructure. So there is on the table right now, there are negotiations over the possibility of over $300 billion in investments in affordable housing. Just a historic and tremendous opportunity if we're able to get that money actually enacted, and if we target it towards the greatest needs and the people with the greatest needs. So we are urging to seize this moment and get these long-term solutions in place, which include universal housing vouchers available to all eligible households in need. We need to build more apartments affordable to lowest income people by expanding the National Housing Trust Fund. And we need to preserve the affordable housing that exists today, primarily public housing, with a $70 billion infusion for capital repairs. We can get that done in an infrastructure package. And that window is open right now, and it will be closed 6 to 9 months from now. And it really is, I think it's more than a once in a generation. I think it's a once in a lifetime opportunity to get this right. Beyond those investments, we need a permanent emergency rental assistance program, what we're calling a national housing stabilization fund. Cash assistance to help people make rent when they can otherwise do so, but then they face a pandemic or a natural disaster or just the everyday disaster of being poor, like having a broken down car or having a sick child or a missed day of work. And we have a whole set of solutions that we need, robust renter protections to rebalance this power that tilts so heavily in favor of landlords at the expense of renters. So things like expunging eviction records, right to counsel, source of income discrimination protections, just cause evictions. Those are the long-term solutions that we have to achieve as well.
Yeah. And actually, Emily, I'm sort of interested in what you think the prospects are of that happening. And actually, maybe we can unmute all of the panelists, if you don't mind. So if people want to chime in, I don't know if you can do that, but I'm just curious what we just had this report that came out today from the Joint Center for Housing Studies from Harvard. And, it just paints this picture of things in many ways just getting worse. Housing costs are going up. The people who are wealthy are able to buy new houses, and that's just squeezing more people out of the market. So we have that happening. What do you think the prospects are that these problems will be addressed or can be?
That's just the thing. They are entirely preventable. It does not have to be this way. And I think Diane just did an incredible job outlining the agenda. That strategy addresses the inequitable eviction system that perpetuates the harm, the affordable housing crisis, and this mounting debtor crisis all at once. And then we also have the situation where there are two Americas, where people entering the pandemic did not have the safety net or the wealth accumulation to actually ride out this storm. At the outset of the pandemic, 70% of Black and Latinx households did not have enough emergency expenses to cover 3 months, whereas only about 17% of white adults had the same outcome. And we know that the median wealth of a white household is 7 times that of a Black household and 5 times that of a Hispanic household. So we have these two tracks happening in our country that if we don't put a stop to it and really rectify that tilt and shore up people who have been disadvantaged and facing disparity and subordination for far too long, it is going to continue, and we will see the result of that in the health, the well-being, and the life expectancy of our communities. I did want to mention that I think the audience here, the medical legal partnerships across the country have a significant role to play in achieving all the goals that Diane mentioned. You are on the front lines. You are seeing people at the earliest point in time in this crisis because they go to their providers. They don't often go to the legal assistance organizations until it's far too late and far too downstream to really intervene and prevent that long-term harm. So as much as possible in this moment, let's change our screening criteria. Let's change our assessment and identify people who are at risk of eviction, who are eligible for rental assistance, and link them up right away. Because most of the medical legal partnerships across the country are community-based. They have really strong ties with community-based organizations, with the religious groups in the community, and they're trusted. And so this is a really great opportunity for us to link up and create diversion programs and make sure that people are accessing rental assistance and getting it to the hardest hit communities as quickly as possible. So do I think that this is possible? Do I think we can prevent this harm? 100%. It is entirely a choice that our country has to make at this moment. And we can, and I'm seeing an increase in people being able to share their voice and to be heard, that there is a huge increase in the development of tenant associations across the country, in building associations and organizations that I think is starting to shift the power balance and to make sure that people recognize just how devastating and catastrophic the experience in the pandemic and even leading up to it has been for far too many people in our country who deserve so much more.
Anybody else want to chime in on this? Jennifer, Peter?
I guess I could say a little about, like, from the utility side of things. Priorities in the short term are probably strengthening those programs that I kind of ran through quickly. And so, looking at what's available in your state and the way that we have had better protections put in place for utility consumers is really through, advocacy at the state level, and pushing, either in the legislature or administratively through utility commissions. I think more broadly, though, seeing utility service as a basic human need and a human right, and something that, yes, we have to pay for utility service, but how can that be structured in a way that doesn't shut out people who are struggling and who are just going to be pushed further, made further at risk, pushed further into poverty if they're not able to afford their utility bills. So I think that's, in the long term, what I'd like to see.
I actually wanted to take a few questions from the audience because most of them seem very practical. They want to what can we do? Where can we go? How can we find information? And so one of the first questions is, what strategies can health centers adopt to proactively identify and address housing and eviction issues? Is that something that you can address, Kerri, at all? I'm just, where do they go for information? Where are they, they're a health center and they want to, obviously they realize that this is a related issue, housing, how can they get information, and where do they go and resources to help?
Yeah, so for health centers, I think that the power there is really that, especially for major teaching hospitals, I'm picturing, Johns Hopkins in the middle of one of the most, depressed areas of Baltimore. The power there is that they have a very loud voice, right? And to the extent that you could kind of use that voice to promote policies and creative housing solutions for folks who are suffering. I think that's one approach, but that depends on how high up you are in your system. In terms of identifying resources, a lot of the resources have been put in the chat. The Network for Public Health Law also has put together some fact sheets on different approaches, policy approaches to assist the plight of tenants in landlord-tenant cases. RTC is one of them, right to counsel, eviction diversion and eviction diversion programs, limiting public access to records, and deterring serial eviction filings. I think that's all of them. Those are, somebody already put the link in there. Thank you very much. Thank you. Those were our students worked on those all year, and they did a really great job. There's information out there. I just think that the need is really to use your voice to be, to kind of push change, because I'm a little bit more pessimistic, I think, than others who've spoken about whether, your initial question, Pam, about can things change? Well, yes, they can. I just think we need to make it lucrative. Unfortunately, it's a market-driven system, right? And so it's got to be made profit-worthy for folks that need to act. So.
Yeah, and actually, so I want to come back, Sargway, to one of the initial questions I asked you, and just, I don't want to put you on the spot, but how do you bring landlords into this? We've talked about the healthcare providers, the legal aid, the tenants. Obviously, the landlords are also a part of this debate. And some of them will argue the fact that we've had eviction moratoriums, have actually hurt the problem long run, because that means they've had less money to invest in affordable housing. So how, when you're talking about trying to address these problems early on, as you mentioned, do you bring the landlords in? How does that work?
Yeah, I think cooperation is very important on this issue. With the eviction moratorium, we also saw moratoriums in foreclosures. We saw programs for property owners that had federally assisted mortgages to have their payments deferred. So we did see policies that were directed at property owners. But I think one of the big things that I've seen in my work as far as bringing landlords to the table to have these discussions is to have a place where landlords and tenants can just go through whatever their issues are and go through this dispute process without having to start at this really harmful court process.
Right.
I think a lot of times we go straight to the eviction filing stage because there's nothing really there before that. That's where, you know, the tenant gets the paperwork, they start paying attention, and then at court is where we have these discussions where we try to negotiate these agreements, but oftentimes we're already in that filing stage and those harmful effects of eviction have already started. And so that's one of the great things about eviction diversion and any alternative dispute resolution program is that it just gives tenants and landlords somewhere else to go. That isn't, you know, this adversarial court process. That is a process that has, you know, more people involved, resources involved, and a chance to come to resolution without getting further down in that timeline where those harms start coming up.
So actually, I'm curious, like, how hard was it to set up the program and how costly? I mean, is it something that you think people can replicate fairly easily around the country, or was it a big challenge?
So in Philadelphia, we actually already had a mortgage foreclosure diversion program prior to the eviction diversion program. And so part of setting up the eviction diversion program was just looking at the program that was already in place and seeing its success rates and seeing what worked for them and converting that to eviction diversion. And so we were unique in that we already had kind of a foundation. But I think the thing, at least that was really, well, not, it was pleasant to see was that once the program was running, there was actually a lot of buy-in from landlords and landlords attorneys. It was set up in such a way that it really was a conversational process, not adversarial. And I think that to your earlier point, a lot of times people just want to have their issues resolved. Like landlords want to get their back rent paid, or you know, if there are repair programs that are available to property owners to deal with repair issues, that kind of information is something that needs to be communicated to both the tenant and the landlord. And so I think one of the things that was nice is that it kind of benefited all parties who really just genuinely wanted to reach a resolution in the housing you know, with the housing problem. But yes, to answer your question about setup and about the difficulty, apart from having that kind of basis of the mortgage foreclosure program, we definitely had to do a lot of training because a lot of the housing counselors that were part of that program only knew and only had really backgrounds in mortgage in foreclosure. And so we had to retrain housing counselors on just the eviction protections, what tenants' rights are, what landlords' rights are, and what their obligations are. And that was an effort between Community Legal Services of Philadelphia and other nonprofits. And so one of the things that I think is key to starting a program like this is not only to have, you know, buy-in from your city councils, buy-in from the courts, buy-in from the landlords, but also to have collaboration between different tenant and landlord organizations, because there needs to be training, there needs to be appropriate setup, there needs to be a central place where people can, you know, register for these mediations, and all of this takes collaboration between different organizations. So I think that was the key for us, is just, you know, we had a really strong pool of advocates and different organizations that were invested in advocating for this program, in training people and setting up online systems so we could track the mediations. And I think that if other cities want to replicate that, that's the first key, is to just have that buy-in from all of these different parties.
That's great, thanks. And actually, I don't know if this is Peter or Jennifer, but maybe both of you could talk a little bit about, you know, what sort of, first of all, how much money do you think it would take to actually address these utility issues, that, if you know that, I mean, how big a problem are we talking about? And is the money out there? What's the biggest challenge to trying to address that issue?
So I can get started and then maybe pass it off to Jennifer. I think one of the largest issues that I've noticed, and certainly I think is echoed perhaps by my colleagues as well, is the lack of availability of data in many of the areas in which we work. Certainly in the utility space, as it relates to public health outcomes, it's been incredibly challenging to understand the scope, nature of these problems. One of the biggest issues is that until our paper was published, there was almost no data in the academic literature available to try and understand who all were the folks who were benefiting from these medical protection programs. And our paper only reviewed a small set of patients within Connecticut. And so really getting the first step is just having a nationwide understanding of who the patients are who need protection, what their medical needs are. That, for me at least, would be a great first step in trying to understand the scope of the problem and the budget that would be needed to try and solve that problem.
Yeah, I definitely agree with Peter's point that data is a challenge. And I mean, the way utilities are regulated, every state has jurisdiction over their own state's utilities. And then there are also within many, if not all states, there are also co-op or municipally run utilities that might not be fully subject to like the state regulatory authority. So yeah, absolutely, there's a need for more data. And I mean, I think we do in some states, we do have some reporting about, what low-income consumers are experiencing. And, for instance, in Massachusetts, we know that for low-income customers in March of 2021, compared to March of 2020, their utility debt had grown by 28%. And this is, unfortunately, a group that had already carried a significant amount of utility debt heading into the pandemic. So, in terms of like a whole price tag, I guess it's really hard to say. One of the encouraging things that's happened with the federal stimulus funding is there was additional funding for LIHEAP for fuel assistance, and
Right.
I think that can be very beneficial for a lot of folks.
How long does that in existence for, or does it expire?
I think it has to be allocated or somehow spoken for by fall of 2022, if I have that.
So there's a while.
So yeah, but it's not something that is an ongoing increase, but there's potential to advocate for more LIHEAP funding. There's also short-term programs to help people with broadband, with internet access at the federal level. There's an emergency broadband benefit, and there's also being developed a water assistance program at the federal level. So these are great.
Stupid question. Why do people need water assistance? I know that sounds silly, but
yeah,
is that a big problem?
Because yeah, actually it is that, there is an ongoing problem of people having water service disconnected because of a lack of ability to pay. And a lot of the protections I talked about, they apply to electric and gas service, but water is another story. So there hasn't historically been a lot out there to help people to pay water bills.
So one of the questions that we have from the audience, if anybody can chime in on this, is so one audience member asks, where can we find resources for jurisdictions with no dedicated housing court? So I guess it's again a place, people are wondering where to go, to look for ways that they can help. Any suggestions?
So I think the same principles would apply for jurisdictions that don't have housing court as those that do, that the eviction system is still incredibly inequitable, and the majority of cases result in the displacement of the tenant. So in those jurisdictions, it's really important to work for right to counsel. And we know that based on a study in New York City, after they adopted right to counsel, 84% of tenants stayed housed. And that speaks to the grave injustice and the frivolous nature of so many of the evictions that are filed. The Eviction Lab has identified the phenomenon of serial filing, where the eviction system itself is used as a way to control tenant behavior, to assess fees and fines, to remind people to pay the rent. And all of that triggers that record of eviction that results in that downward spiral and pushing people to the outskirts of society into substandard housing. So I think the same strategies that you've heard about already apply in those areas as well. And also really helping to increase agency of tenants. That many tenants are entering eviction court already with a diagnosis of depression, anxiety, suicidal ideation, PTSD. There are so many studies that have really looked at who is interacting with the court system. So they're entering court in a setting of trauma, almost at the brink of losing their home, their livelihood, the roof over their children's head, and not knowing where to go next. And so adding those diversion programs are really critical. Advocating with the court system to issue a general standing order that is a backstop in this crisis and diverts those cases to apply to rental assistance before they can be filed. That can happen at the community level. And we've seen that in multiple places already, even smaller magistrate type courts. So I think the same principles would apply there. And you also still have access to legal aid. So partnering with the legal aid organizations, the community-based organizations, and these medical legal partnerships. The medical legal partnerships have an opportunity, if you're an FQHC, a community-based, school-based site, especially, to screen every single patient for risk of eviction, for substandard housing conditions that are rampant in those neighborhoods. And even as a former MLP director with an FQHC, you can use the electronic health record to surface systemic problems in specific zip codes in your community, of course, following IRB rules, but it can help you really target your interventions and outreach to the community so that you're knowing exactly who's being affected and where. The other thing I wanted to mention about the diversion programs, the Philadelphia program, one of the benefits of that program is the housing counselor and the mediation, that person is helping to increase agency and make sure that the tenant has the ability to exercise their rights, to raise them in that mediation situation, which we don't often see if it's just strict mediation with two unrepresented parties, because of the power imbalance and because of the discretion that the landlord has over the outcome of the case. So that's a really critical component. And also that the ERA funds, 30% discretionary funds, can be used to create those programs. So we talked about funding, and that is an allowable expense because it's a housing stability program.
Can I also ask the panel about a little bit about, sort of people who are not even in the system, people who don't, tenants who actually might not have a lease, who might not, they have very informal arrangements with their landlord. It seems to me that they are completely cut out of protections. People who will tend to self-evict because as soon as the landlord gives them any indication that they might try to take them to court or do something, just decide to move. How big a problem is that? And is there anything that actually can be done about it?
I'll jump in to say that you're right, Pam, that is a significant problem. Those are some of the most vulnerable, the most marginalized people who are most in need of assistance, short-term and long-term. And people with informal leases, undocumented immigrants, they are some of the households who have gotten no help whatsoever throughout the pandemic. They didn't get stimulus checks. They didn't get extended unemployment insurance. The good news is that the emergency rental assistance can be used to assist people with informal leases and undocumented immigrants. And some states are being explicit about creating programs that serve their needs and serve those households, others much less so. And one of the places where this shows up is one of the major obstacles in the emergency rental assistance program, even more broadly, which is programs that have very cumbersome application processes and that require really burdensome documentation from applicants. So, there are a number of eligibility requirements for emergency rental assistance, and some of them are difficult to prove and some more than others, especially for certain populations. So, for example, For some people, it's very easy to prove that you are a tenant and that you owe a certain amount of money to your landlord because you have your formal lease. When you have an informal lease, or you live in a motel or a hotel, or you have other arrangements to pay for a place to sleep, it's much more difficult to prove. That's why in the law, it allows for program administrators to use self-certification or self-attestation for many of the eligibility requirements in the programs.
And so how many places are doing that? How many
Not
states?
enough. It's still the minority of programs. We're tracking about 400 emergency rental assistance programs that are up and running today. And on the self-attestation, I'd say only about half of them are utilizing self-attestation. Right. That means that, people fall out of the process during the application period, and they don't get the assistance that they need. So, about a month ago, the White House and the Department of Treasury put out really clear guidance to programs that they should not require burdensome documentation and that they should use self-attestation. And so we're seeing an improvement. There are a number of programs that are course correcting. It was a much lower number even of the programs who were using self-attestation before that guidance from the president. So it's improving, but it's still not where it needs to be to reach those most vulnerable people. Another big challenge has been landlords refusing to participate in the program. And again, this harms some of the most marginalized tenants the most. And the protection there is that programs, when landlords refuse to participate, they can, and now the White House has made clear that they must give the assistance directly to the tenant, for the tenant to have the cash they need to pay the rent. There too, there's not enough programs utilizing that yet, and we need to do more to get all of the programs to do direct-to-tenant assistance, especially when a landlord refuses to participate.
And I guess the big problem also is just getting this information out to the tenants or to the people who might benefit from some of these, from this assistance. So I guess the question that I assume a lot of our listeners would have is, how do you get that information out to the people who really need to do that? Is there any practical suggestions that you have?
I mean, a few things that the White House could be doing and the Biden administration could be doing is much more of sort of a public education campaign, which they could have and neglected to do. The previous administration neglected to do it as well with the CDC eviction moratorium, to let people know about the protections that are available to them, to let landlords know about the obligations that they have under the order. And so it was left to organizations like ours and many of my colleagues here on the panel and who are participating to try to get the word out as much as we could to tenants. Something similar is happening now with emergency rental assistance, and it doesn't have to. There should be like a major public education campaign at the federal, state, and local levels to let tenants and landlords know that these resources are available. Also, landlords and landlord associations could do much more to educate tenants about these programs that exist, which serves their goal of getting the rent arrears paid to them and also certainly assists that tenant. For people who are on the line now who want to know what to do, I would point to at the National Income Housing Coalition on our website, we have a pretty comprehensive and easily searchable database of all emergency rental assistance programs that are up and running. So I'd encourage people to, if you know of somebody who needs housing assistance, to check out that database and find the local programs that might have resources available to help.
And actually, we're sort of running out on time. There's so many things to talk about. I'm wondering, Danielle, is there a question from the audience that you would like to highlight and we can ask?
Yes, there is a question from a tenant, I believe, and they were asking if they made a maintenance request and the landlord did a retaliation eviction. And because they're on a month-to-month, so also the application of the moratorium on a month-to-month, what can they do, especially if the landlord will not accept any vouchers?
Kerri, is that something that you can answer, or is that too practical?
Yeah, right. In part. So in Maryland, we have the Home Act, which is it prohibits discrimination based on source of funds. So a landlord wouldn't be able to at least assert that the reason that they were refusing to rent was because they were paying with a voucher. But in terms of, I was actually going to bring up the issue of conditions. That's been a major problem that we saw. And I've seen a lot of comments in the chat too about kind of villainizing the landlords. And that's really not the goal here. We're just kind of describing what we're seeing happening out there. There are good landlords. Of course there are. There are people who are, this is their livelihood. This is how they put food on the table and keep the lights on in their own homes and in the homes that they rent out to others.
And just real quickly, many are very small mom and pop landlords, right? And they're not very rich people who are just making money off the tenants.
Correct. So we do want to be fair and acknowledge that, but also, there are a lot of situations where there are, for example, like hedge fund owners of large apartment complexes, and there is almost no incentive to keep those apartments even up to code or habitable. And so, especially as Diane was talking about, where the tenants are undocumented, we had a lot of that kind of situation happening. So people are not able to afford the rent themselves. And so they have multiple families living in a dwelling, which is technically in breach of the lease. And so folks are afraid to assert anything, like there's a hole in my ceiling. Well, you're living 3 families in your apartment, and so I could technically evict you. So conditions is a major issue, and to whoever asked that question, we've seen some success with community-based organizations doing some really good community organizing around that issue, kind of using the power of the media to shed light on things that are happening in that regard, where and the courts are very episodic, right? I have already forgotten the initial question, Pam, but it had to do with a specific instance of somebody making a complaint and having a retaliatory eviction, right?
Right, what protections do they have? Yeah.
Right, and so it depends jurisdiction to jurisdiction. So one of the other attorneys on the panel might want to field after me. But at least in Maryland, you could assert, implied warranty of habitability. You could, the problem with rent escrow is that you have to be able to pay the rent in order to initiate a rent escrow claim. So that's not particularly helpful either. And then there's always, the Fair Housing Act, disparate impact and those kinds of arguments, but that requires filing in court, right? And so, all of this is intimidating and scary for tenants. And so it doesn't tend to happen. Hence the power imbalance.
Yeah. Oh, I'm sorry.
Emily went like,
I think we had have a time, I think, Bethany, right, just for a very brief answer, or do you have to go? Do we?
Let's try to, we can get a follow-up, and let's try to squeeze in one more question. And folks in the audience, please feel free to continue sending your questions and comments in the chat. We'll collect them and we'll try to do our best to follow up.
Yeah, and I would highly recommend looking at the chat too, because there's some great discussions going on there as well. Actually, Danielle, why don't you give it, what's a follow-up question? Another question?
Just basically, as a concerned and informed citizen, what can we do?
Oh boy, that's a broad one. Okay, Sarikwe?
I think now more than ever, it's really important to build power within communities.
I think we're losing your volume.
Oh, can you hear me now?
Yeah.
Okay. I think now more than ever, it's so important to build power within your own communities. Where, in my jurisdiction, or at least in our neighborhoods, like there's so many community organizations that you can get involved with as a tenant. A lot of the community organizations that we were involved with prior to the pandemic have moved their meetings to Zoom, which in some ways makes it, in some ways, if you don't have a phone or computer, it's less accessible, but it does mean that people who are in different locations can come to those meetings more. And so I would say, if you're a tenant and you're not sure what to do right now. Reach out to your neighbors, reach out to your friends, see who's going to what meetings, because a lot of times what's happening at those meetings too, or at least what I've been doing in the pandemic, is attending as many community meetings as I can to give trainings on renters' rights, on the process for eviction, and on just what people can expect as these moratoriums lift. So if you're a tenant and you're not sure what to do, I would say get involved with your community, attend community meetings, and start talking to your neighbors, because this is the time to build power within communities. And I think that's so important for all of the policies that we've spoken about today.
Well, I think our time is out, unfortunately. I just want to thank the panelists so much. I know you guys have so much more that you could contribute, and but I think this has been really helpful, and onward. Thank you, Bethany.
Thank you, Pam. I just want to wrap up by saying another huge thank you to all of our organizational partners. Pam, for taking time out of her schedule to do what I certainly could not do. I am barely a lawyer these days and certainly never have been a journalist. Thank you, Pam. All of our panelists, thank you so much for sharing your knowledge, your expertise, and generosity of time with the audience. And audience, this was a town hall. You all were very chatty, as we hoped and expected in the chat box. If you really enjoyed today's event, take a moment and fill out the town hall survey link. This was a HRSA funded event. And so it's the obligatory ask, please fill out our survey and let us know how we did and how we can continue to improve. Thank you all for attending today. We'll follow up with all registrants. Stay safe out there, get vaccinated.